Now, borders are still keeping families apart, stopping sick people from getting to hospitals, but premiers like Queensland's Anastasia Palaszczuk show no sign of backing down. She wants to keep southerners out, even those just across the Tweed. But she will set up a new exemptions unit so that bureaucrats can look at making exceptions to the rules for some medical cases. I mean, give me a break. More bureaucrats. Watch them stuff this up. Just let people go to their normal medical centre or their closest hospital, regardless of borders. Surely that's what we need. We are all Australians, and this is not Ebola. This is coronavirus. Melburnians are still being spot-checked and fined for straying more than 5 kilometres from home or for being out after 8 p.m. at night. But Daniel Andrews says he won't even detail a plan to ease restrictions till next week. He won't rule out extending stage 4 beyond September the 13th. And he's looking at Christmas as a landmark to aim for the new normal. That's with just 73 new cases in Victoria today. But while he's locking his fellow Victorians down, the Premier is proud of them.
I am so proud of every single Victorian who is doing the right thing. I am deeply, deeply grateful to every single Victorian who is staying the course, who is making their own personal contribution to a strategy that is defeating this virus.
It is hard to believe how patronising this stuff is. And it's hard to believe, frankly, how meekly most people in Victoria seem to be accepting this. Although I was speaking to his friends in Melbourne today who said you kind of have to. You don't want to be the flog who's out there breaking the rules, of course, and you're all in it together with your neighbours. And so while you might worry in Victoria that Daniel Andrews has gone way too far, you've sort of got to buckle down with your neighbours and do the right thing. I understand that. Still, the curfew and stage 4 lockdowns were probably unnecessary, as Professor Peter Collignon suggested on this program last week.
We had the epidemic in March and April and it turned around, and it probably turned around before all the more major restrictions were put in place. Now, it's not that restrictions won't aid it. You know, you'll get more benefit if you really have everybody stay at home and not move around in curfews. But how much extra benefit, at what cost, I think we're going to have to start working that out. Because if you look at last March and April, the two places that had the hardest lockdown, New Zealand and actually Victoria, haven't necessarily had the best results over the medium term.
Still, Andrews is doubling down and says he'll reveal his plan on Sunday that will provide this roadmap for easing restrictions. But don't get your hopes up. He says it's going to take a while.
We will defeat this second wave, and if we do it properly, and we will, with a phased, appropriate, safe and steady opening up, then we will avoid a third wave. We will avoid, again, losing control of this virus, seeing thousands of people in hospital and hundreds of people losing their lives.
Here he goes again. Why do they keep over-dramatising the threat? Victoria hasn't had thousands in hospital. The highest tally it's had in hospital on any one day was less than 700. More than 95% of infections are mild or even asymptomatic. And of course, the overwhelming majority of deaths, 75% or more, have occurred in aged care facilities. Still, there are some people starting to arcing up again, more to the point. Former footballer and media personality Sam Newman protested about not being able to play golf during the first lockdown. Andrews said golf could lead to people dying. Now Newman has tweeted about a mass rally. He wants 250,000 people to gather in Melbourne and reclaim the city and the state, as he puts it, saying that without this, every previous protest will have been pointless. Well, that's just a little bit crazy, of course, just as silly as the Black Lives Matter protest that the Victorian government failed to stop back in the day. But the frustration is understandable. The scale of the remedy is out of all proportion to the scope of the problem, in particular the quite narrow cohort for whom it poses a deadly threat. On aged care, the federal government has turned its attention to extra funding to deal with the pandemic, something it clearly should have been focused on since February. Aged care has accounted for 3/4 of Australia's deaths.
During the course of COVID, we've added $1.5 billion of funding to the aged care sector to help deal with preparedness and response. Of course, in relation to the Royal Commission, as the Prime Minister said on the day that he announced it, that there would inevitably be additional investments over and above the continuing ones, which we've made since we called it, over and above what obviously we've announced today and other things with COVID.
Better late than never. I'm talking about the federal government's action not rolling that clip. Better late than never. But really, this focus should have been there 3 or 4 months ago. It was very clear. Now, in South Australia, just to dwell on the theme of cowering populations, they have just one active case. But in a state that didn't really have a first wave of the virus, they're worried about a second wave, apparently, according to a health department survey in that state. People, we got to get a grip. This virus will be with us for a long while. That's what all the experts tell us. We are hurting each other, dividing the nation, hurting ourselves. Thankfully, Scott Morrison wants all of our internal border blockades gone by Christmas, but that's a long way off. And apart from some restrictions involving travel from Victoria, none of these border restrictions are justified. None of them. We need to learn how to live with COVID-19 while being sensible about minimising its spread and protecting the vulnerable.